there's this common dialogue around women, and women's health is like, as we get older, the hot flashes, the weight gain, and it's just like, just accept it. You're getting older. It's so infuriating, right? Because it diminishes the alert that the body is giving that something's not right. This is a big part of what we're going to be talking about during our retreat, which is hormonal health. What happens as our body changes as we get older, and what we can do to find a little bit more peace and balance within our body.
Welcome to Voices of Esalen. I'm Sam Stern. Today we're exploring the powerful and often overlooked terrain of pelvic health. When it's balanced, it supports ease and vitality. When it's out of balance, it can profoundly affect the quality of our life. To guide us today, we're welcoming two extraordinary practitioners who are going to be teaching at Esalen soon. Dr. Tia Ukpe-Wallace, an orthopedic and pelvic health physical therapist, yoga teacher, and founder of Self-Care Physio, whose own experiences with pelvic floor challenges and pregnancy loss have fueled her passion for empowering women with knowledge and healing practices. She'll be joined by Krishna Dholakia, a nutritionist, certified diabetes care and education specialist, and yoga and mindfulness teacher. Through her practice, Om and Spice Wellness, Krishna offers an integrative approach to women's health spanning preconception through menopause, weaving together evidence-based nutrition, yoga, bodywork, and mindfulness. Together, they share insights from their upcoming Esalen workshop on pelvic health, covering topics like pelvic floor anatomy and self-care, menstrual and sexual health, nutrition and digestion, mindfulness, yoga, and community building practices. Guest hosting today's episode is our own Shira Levine, Esalen's Director of Communications and Storytelling. Shira is a writer, producer, director, and researcher, and has created work across documentary film, editorial journalism, and global communications with organizations ranging from the United Nations to leading national print and digital media outlets. I'm sure you're going to enjoy this conversation, so let's get to it.
My name is Ukpe-Wallace, but I go by Tia, and I am a pelvic floor physical therapist, also an orthopedic physical therapist, and I'm based out in Oakland, California, and really excited to be in conversation with Shira and Krishna just to talk about our upcoming retreat in October.
I'm Krishna. I'm a registered dietitian and a diabetes specialist and a yoga teacher and a mindfulness and MBSR teacher. I work in the area of women's health, diabetes management, and helping people who are living with conditions like autoimmune conditions. And I'm really excited to be co-hosting this retreat with Tia at Esalen and be having this conversation.
Can you talk a little bit about your backgrounds, what brought you into this space and to begin with? I wanted to not make an assumption, but I'm assuming you both might be in your 30s.
I'm in my 40s.
Oh, you guys look great. Okay, so we're all in the same boat. I was like, wow. Okay, so okay. I will reframe. So if you can talk to me a little bit about what brought you into this work and your backgrounds, and then we'll go from there.
Yeah, I can go first. So yeah, I'm in my 40s, but a lot of the reason why I got into this work really started when I was in my 20s and dealing with chronic yeast infections, bacterial infections, and not having a very clear understanding of what was going on, why it was occurring. And it was kind of like ongoing for about 3 years while I was in a monogamous relationship, and experienced, pelvic pain, so vulvodynia, just like a lot of irritation with intercourse. And a lot of the remedy that was given to me was really very medicalized and not really having a true understanding of like how my diet was having an impact on, what was happening in my pelvic floor. And then even just the stigma around painful intercourse. And I didn't know who to talk to about that. So that was in my 20s. And then I ended up getting married. I got pregnant first try, and then ended up having a 20-week loss with my first child. And again, another stigma of like no one really talking about miscarriage and pregnancy loss from me not really having addressed what was happening in my pelvis during that time. Ended up with another type of pelvic pain, which produced a lot of rectal spasms. and not really having the funds or know who to go to speak to what I was experiencing. So a lot of it was really trying to figure it out on my own. And it was during that time frame that I had decided I was going to go to grad school. Went to grad school, found out that I can specialize in pelvic floor health, and so was able to do that. Ended up having my daughter, but ended up having a C-section. Even before that, I had a surgery to remove fibroids because I had a fibroid diagnosis, and then had surgery for that, and then had a C-section when I had my daughter. Then even just the recovery of both of those surgeries, was a lot on my body, and not something that I sought a lot of care or was able to seek care for. Went into PT school, graduated, became a physical therapist, and decided I wanted to specialize in pelvic floor health because I really wanted to be able to offer the type of care that I didn't receive. So whether it was in my 20s, my 30s, and then even currently where I'm, dealing with secondary infertility and also perimenopause, like beginning of perimenopausal symptoms, not knowing who to talk to about a lot of what I was experiencing or how I can be able to address it in a more holistic or integrative way without it having to include just medication or just I'm a woman, I'm this age and I just need to kind of suck it up and deal with it. So and a lot of my own experiences is what kind of brought me to where I'm at right now. And I'm really thankful I've had those experiences to be able to then help others.
Yeah, that was so beautifully said, Tia. I would say that I've had different experiences, but similar along the lines of working with individuals who are having either women's health symptoms or conditions or imbalances with their bodies, and also specifically related to their pelvic floor. I started working in the healthcare field 20 years ago as a dietitian and a health coach. And I was, one of the first pioneers working in telemedicine. And at that time, we were trying a more integrative model of not just speaking about nutrition, but also talking about stress management, tobacco cessation, and physical activity planning. So kind of really looking at the full scope of like what keeps an individual well. And a lot of our clients at that time were working for big, like Fortune 500 companies, sitting all day long, high levels of stress, not really having enough time to even have lunch, right? And so the more I spoke with them and counseled them, the more I realized the overlying symptom that they were experiencing was stress and burnout. That kind of influenced my decision to become a yoga teacher and just learn more about the body and movement and pranayama and breath work. Started studying yoga, practicing more, and then decided to become a yoga teacher and go back to school or yoga school. And from there, it gave me more tools to really help my clients, to really help calm them down during our sessions. Because so often when you're working with someone, if they're stressed out, they're not going to hear you, and you need to kind of really work with what's happening in the room or what the priority is in their life. And so once I had that experience and that, that the ability to really work with them in a different modality, in a different way, I felt like it really kind of opened them up to receiving more information and also receiving more tools to work with to get healthier and balanced. So aside from being a dietitian and a diabetes educator, this yoga and mindfulness addition to my skill set has really helped me offer a more integrative functional medicine model to the people and the groups that I work with. And along my journey, I was working with a lot of women and just noticing them talking about things like UTIs and yeast infections and also just like PMS, right? And gaining weight. This is a common one that I would hear, gaining weight as they got older. The level of frustration in that they would have around not being able to lose the weight and trying everything. And so I think we all have, maybe we have someone in our life, or we know this, or we hear it in just like TV, or there's this common dialogue around women, and women's health is like, as we get older, oh, the hot flashes, the weight gain, and it's just like, just accept it. You're getting older. And it's like, it's so infuriating, right? Because it diminishes the alert that the body is giving that something's not right, and this is a big part of what we're going to be talking about during our retreat, which is hormonal health, and like what happens as our body changes as we get older, and what we can do to find a little bit more peace and balance within our body. But, personally, when I was in my late 30s, I started to get pelvic pain, and I didn't know why it was happening, and I just noticed the start was like changes to my digestive health and changes to like my regularity and not feeling like the same. And actually, this was also during the pandemic. So I was like, is it stress? Is it that I'm getting older? What is it? And I was like, there are all these different factors happening. And so I started going to doctors. They kept on handing me off to another doctor. And the other doctor handed me off to the other doctor. They put me on like different medications that didn't help. And then eventually someone gave me a referral to see a pelvic floor physical therapist. And they really were the main care or the provider for my care. And they helped me so much. And during the course of my care, I guess that's the way I would like to use the word I would like to use, is I've worked with 3 different pelvic floor physical therapists, and they've all been incredible and really helpful. And I always knew about this work as a prenatal yoga teacher, and knew about the pelvis a lot and learned a lot about it in relation to pregnancy. But when it came to, just treating my own self, it was extremely helpful to learn to work with someone who is incredibly knowledgeable in the area. Actually, I went to my pelvic floor physical therapist today, and we were in the treatment room. And as she walked out and she slit the door closed, there's this older woman outside doing exercises right outside the door. And she was like, what is this treatment room for? And then my physical therapist was like, oh, pelvic floor physical therapy. And then as she walked away, she asked the assistant that was working with her, what is pelvic floor? This older woman was asking, like, what is the pelvic floor? And the assistant happened to be this like young guy, and I could hear in his voice that he felt really nervous and embarrassed and didn't want to tell her. Like, he didn't want to explain it to her. He was like, oh, it's like related to the pelvis. And then she was like, pelvic floor or pelvic floor? And then he was like, no, pelvic floor. And then she was like, well, I guess I don't have to worry about that because I'm not pregnant. And I was just like, this is like this. And it just made me laugh, but it also like, it's like, it just shines a light on like how much more education we need to give women on this area of our bodies that no one talks about. More than half of the people out there don't know what the term pelvic floor means. So this has been like a true journey for me, both professionally and personally. And just like Tia said, a lot of the things we go through in life, especially when it comes to pain, is both a gift and a curse. And the truth is that when you're dealing with pain, it's incredibly hard. But if you can use the things that you've learned to help people and to kind of shape the way you offer care, it can be a blessing.
Today, I posted something on Instagram that was around the idea of equity and how when women go into, a gynecologist's office or any type of medical facility, how women of color are treated different than white women. And then we just have women in general versus men in the medical field being heard. And so that made me think of an essay I read years ago that I often share with my Black girlfriends who often are dealing with hysterectomies earlier than probably necessary and fibroids, and how that we have to be our own advocates in saying, okay, so I've asked you for this service. Can you please put on record that I asked for it and you declined it? And so that's just something I always share with my friends. I'm wondering if you could speak to equity, being that both of you are women of color.
Yeah, I could speak a little bit. So currently, a lot of the clientele that I treat, they are in the pregnancy and postpartum population, and I think I see that a lot, especially in postpartum. So definitely in pregnancy, and again, it's that same dialogue that you're pregnant. That's just part of the course of pregnancy is that you are going to experience pain. That as they go through birth, they go through labor. It's going to hurt. It's going to suck. You're going to tear. Your sex life is not going to be the same. Postpartum, like absolutely no care, or thought of what postpartum is going to look like for the mom, is not even discussed at all. And so I definitely see that in that population. And I would say across the board, whether it's a young girl starting puberty all the way up to the elderly lady who is maybe experiencing chronic UTIs and urinary incontinence, that there isn't that I feel like a lot of it, when it comes to equity, and especially for those who are women of color, is that there's just that lack of education. So I think the lack of education for us just as women, as ourselves, because that's not prioritized, whether from our medical provider or whether it's in school, and just getting that general education, or even if it's just the other women in our lives who whether it's our mothers, our grandmothers, our aunties, because they've experienced the exact same thing. So then they don't really have, in some cases, a lot to share to be able to actually help us be better advocates. And so, yeah, then I think then getting that access to care then also, begets like another bigger issue, depending on where you are, what your environment is, who your doctor is as well too. So like just as you had mentioned, that if a woman is asking to have a particular test and if they're being denied, or being also gaslit as well too, and that they have to, put on or requesting to put on record that they didn't make this request and that it was being denied. And I think a lot of it is just the gaslighting, from medical providers of just not really listening to women and understanding that yes, they're experiencing pain, or that yes, they're doing the work of being better advocates and learning more about their bodies. And then instead of being told not to go on Google, or Instagram to be able to find the information, but at least the information it's helping them to start to, have some inroad into what is the pelvic floor, what is going on, why am I experiencing pain during pregnancy, or, they're postmenopausal. It's like, I shouldn't still be having these pelvic floor issues. So why am I still having, urinary incontinence or any of these questions? That I'm glad it's at least starting to open the doors for them. And hopefully, if that medical provider isn't willing to be able to help them, that they can, go somewhere else, or seek care from someone else, or just like, Krishna had mentioned, just like going from doctor to doctor to doctor, and then hopefully that they're able to access a pelvic PT or OT for help. But then the one other thing that I want to just speak to is also, not just the access, but also, I mean, the insurance model, really sucks. And to be able to work with a pelvic PT or OT, it's hard to be able to find one like through the hospital system because there aren't as many and there's a really huge need. And so then if someone is trying to access care privately, it's expensive in order to be able to seek that care and to be able to get that care for an extended period of time, which I think then also deters women from actually seeking out that care, either because they're on really long wait lists, and it's going to be months before they can actually be seen, or they go through the hospital-based system. And because there are so many patients that need to be seen, the level of care, the quality of the care is not optimal. Or then they have to pay out of pocket, when they're already paying insurance, but paying additionally. And so, in some cases, some women have been going through pain or whatever issues for a really long time that they're willing to do that. And for others, it's just not like financially reasonable or accessible for them. And I don't think that's fair. And I'd really love to be able to find a way that we can be able to provide this care, to more and more folks, without finances being like such a huge burden. So I'm hoping that at least this retreat is one way. It can be at least like one little window of opportunity for folks, especially if they do have questions about their own pelvic floor health, or even just to be in community with other women. Because sometimes, again, like if you're leaking, if you're having pain, it's really hard to actually talk to other people, especially again, if they're not listening to you, or they're saying like, oh, it's just all in your head. And you can at least be in community with others and be able to, network and hopefully, find answers. So, yeah, the equity is just like such a huge piece. That was really hard for me because I was in grad school. And so I was on Medicare or Medi-Cal, and I couldn't afford, to get, private pay with a PT. So a lot of it I just had to figure out on my own, and with my yoga background and what I was learning in PT school, and just figure it out. And I know that that's not always accessible or possible for a lot of folks.
Yeah, I'm a healthcare provider at a major hospital system in New York City, and see this a lot, especially with the changes of the current laws that are happening right now related to Medicaid, and a big part of population of my patients are on Medicaid. And so there's a lot of fear going on right now, a lot of anxiety around how their care is going to change. And in some cases, it already has started changing, especially for a lot of federally funded clinics in New York that have lost their funding. There's so much right now happening related to healthcare and politics. And, one would hope that healthcare is a basic human right for everyone, right? But unfortunately, that isn't the case. I'll give a case study, because this is something I see quite often when I'm working with people, especially immigrant women who come and see me. And, I have to say the first thing is that when a woman is bringing up something related to her private parts, it takes a lot for them to bring it up in the first place. They've been suffering for a long time that finally they're like, okay, I have to talk about it because it's unbearable, right? Because there's so much in stigma and shame related to women's health, especially when you're looking at things related to the pelvic floor or sexual health. So talking about things like itching, burning, pain, dryness, pain during intercourse, right? It takes a lot for someone to bring that up to a provider. They've been going through this for a while, and then they're like, okay, I need to talk about this, especially when you're talking about people of immigrant backgrounds. I am South Asian. I grew up in a South Asian family. This is something that, we didn't really talk about that much when it came to like pelvic health or sexual health. But I will say in my case, I was lucky because my dad was a doctor. So there was a lot more openness in my family around this topic. Because I wonder, if he wasn't a doctor, would this conversation be as easeful to bring up, right? And so, as a dietitian and a diabetes educator, a common thing that I will hear when your blood sugar levels are high or people are experiencing insulin resistance is a symptom of that is recurrent yeast infections and UTIs, because you're excreting a lot of sugar through your urine and it's attracting more bacteria, right? And so there's one part of that that's relevant, right? But once that's treated, and if a woman is still getting those yeast infections and those UTIs and, pelvic pain, then there's like a question mark, like what's happening here? And where are the providers referring this patient to? And oftentimes they're being referred to a gynecologist. Now I'll use myself as an example because as Tia was talking, I could completely relate. Because as I was going through my journey, like I saw not only doctors that were in network, I saw doctors that were out of network and paid out of pocket because I wasn't getting the answers that were helpful, or I wasn't feeling better from their treatment. And so I was spending a lot of money to see providers that were out of network providers. I saw like gynecologists that, I saw multiple gynecologists that actually didn't refer me to pelvic floor physical therapy, and it took like finding other people to say, okay, let's refer her to pelvic floor physical therapy. Because I think also as a provider, it takes a lot to say, I don't know what's going on with you. I don't know how to help you. It takes a lot of like courage, and I work with a lot of doctors, and luckily the people that I work with do a really good job referring out and saying that, I think that there are other providers out there that will help you. But like when they refer out and you go and see that other provider and that provider cannot help you because it's a women's health problem, it starts becoming really frustrating. So yeah, it's extremely political, and it has a lot to do with health equity and access. And I hope that like when my patients work with me and they see me as someone who is a woman of color, who is compassionate, who will listen to them, who will also provide additional information and also refer out to the appropriate people. I really believe that every woman should have access to a pelvic floor physical therapist or providers that specialize in women's health. And I think every provider needs more training in women's health. Unfortunately, that's not the case right now.
I shared that I was interviewing you both to my spin instructor, where, I go to a gym that's pretty diverse in terms of backgrounds and age. And so it kind of like started a little conversation, and somebody said that's a rich lady's care to have a pelvic floor person. And I was like, well, I'm definitely going to bring that up to you guys, because as you both said, like that should be part of our medical journey. I mean, I guess what we could jump to already is, what is the pelvic floor? And why does it have this kind of air of mystery or specialization?
Well, the pelvic floor is something that both men and women have, because I think, like, to your comment about that it's a rich lady's problem. But anyone who poops, pees, and is involved in intercourse or sex, like, you have a pelvic floor, and everyone is pooping and peeing. So, and there's definitely pelvic floor, conditions and issues that affect children, and infants as well. So I think that when we have that understanding that everybody has a pelvic floor, then hopefully that just puts everybody on the same playing field. But essentially, it's a bowl. I know I say pelvic floor, and I don't like using the term floor because a floor is very static, whereas I like to think of it, actually, it's a diaphragm. So it's always in direct relationship with the respiratory diaphragm. So every single time that we take a breath, that pelvic diaphragm or that bowl is dynamic. It's always constantly moving. Every single time we take a breath, that we're moving, we're exercising. And so they're a set of muscles that attach, on either end of our sits bones, and also from our pubic bone to our tailbone. And it's the deepest layer of our pelvic cavity. And then if you think outside of that, we have our glutes and our hip muscles. Those are the bigger container, bigger stabilizer muscles, for that. And then the pelvic floor are the smaller stabilizer muscles for our pelvic organs. And so, we all have hips and we have glutes. And so I think, like, again, understanding, like, we all have that same anatomy, generally almost the same anatomy, that's the general understanding, or I guess definition of the pelvic floor or pelvic bowl. To speak to it being like a rich lady's, type of care, it shouldn't be. Again, there are pediatric pelvic PTs, who are working with kids, or babies, who are dealing with like constipation or digestive issues. And, when there's that level of care given to them, it improves their quality of life. And especially for the life of the parents, because the kids are sleeping better, they're eating better, they're pooping, which makes the kid a lot happier. And then for the general, like, 20 to 40-year-old population. So whether it's, us having our periods or going through pregnancy, going through postpartum, just generally, again, digestive issues that any of us, could face, whether it's, constipation, diarrhea, GERD, IBS, like any of those symptoms, it's going to have an impact on the pelvic floor, just because of the direct relationship of, the uterus to the bladder as well as to the rectum. You know, and then like speaking of like perimenopausal, menopausal, postmenopausal, you know, as we age, there's going to be a lot more gravity that's going to have an impact on our pelvic floor. We're having less tone because we don't have as much of like the hormone, the progesterone, or to help to create that plumpness and stability of those tissues. So then we're going to experience, you know, whether it's more UTIs as we get older, or some might experience prolapse issues. And so then that's going to also affect how we're moving, how we're walking, and may end up getting surgeries like a hysterectomy, you know, all of those. So pretty much like throughout that whole entire our lifespan, we can, you know, experience some level of severity, you know, when it comes to our pelvic bowl and the muscles and the organs that surround that area. It, again, like Krishna said, it should be accessible to everyone. Everyone who is asking for it. And also, I think it should be first level care. There's a really great book called the Fifth Vital Sign. And so looking at our periods as another vital sign, just in the same way that we look at our respiration or our heart rate, that our periods are also another way of really being able to be a report card, an assessment of what is our overall health. And so if we're able to normalize it and not have shame, and to be able to talk about our periods or talk about what's going on in that region, then we can also use that as another health marker as well too, as to what is our health like in that particular span of life that we're in. So that way, as we enter the next phase of our life, then we're not going to be burdened down with a lot of these issues, or then having to deal with surgery, or that issues become so far advanced that it's a lot harder to be able to treat. So I think it should be standard of care. And I agree with Krishna, like it should be every medical provider really should have this knowledge and information. And what's interesting, at least kind of speaking as a physical therapist, that a lot of even physical therapists in physical therapy school, you know, you go to physical therapy school and you're learning about, you know, orthopedics, like sports medicine, working with like the neuro population for spinal cord injuries, working with pediatrics, you know, vestibular issues. Like you can go to PT school and to be able to treat like any like issue in the body, but and you know take like a whole semester of classes, you know, on like the vestibular system, for example, but only like anywhere from like 1 to 4 hours of the whole 2 to 3 years of PT school is dedicated towards pelvic floor health. And whether, you know, you're working with someone in orthopedics or they're an athlete or a spinal cord injury, there's going to be a pelvic floor component that has to be addressed. And so it's really surprising that even at least, you know, in this very specialized field within physical therapy, that even physical therapists don't really know how to speak about the pelvic floor, and they're not getting that training.
It sounds like there's just a lot of shame and a lack of understanding and education. And what can we do to shift that? If the pelvic floor could get a rebrand, what would you think would be helpful?
That's a tough question for me because I don't feel like any of these choices were ever designed by women. I think I heard that the vagina actually translates to a place to
A sheath,
store
yeah,
the
it's the sheath
sword.
for the sword.
A sheath to
Yeah.
store the sword. Yeah. So yeah, definitely. I think it's time for a rebrand. I don't have a name right
I
now.
don't
Tia, do
know.
you?
No, I mean, like again, like that's why I tend to like use pelvic diaphragm, because if people already have an understanding of the respiratory diaphragm, then they see it as like, oh, it's just part of the container. It's not something that's like different or foreign.
But a lot of people don't
Yeah.
even understand that, like the woman that was outside of my treatment room today. And it is kind of a term that's slightly ambiguous, right? Like the pelvic floor or the pelvic, even the pelvis, right? Even when you're looking at this area of the body in relation to fashion and style and body image and how it changes, it has changed throughout centuries. I think it's really interesting to observe, you know, in a lot of cultures, having a larger pelvis is considered abundant and attractive. In our culture that we live in now, I've seen it vacillate and change extremely, right? To where skinny is in and now skinny is not in, and now, you know, it's constantly changing. And And it's interesting how it's also now shifted in male culture, especially with the way that men are also wearing fashion related to how their pants hang on them, right? So I think it's interesting. And also, like, this is something I talk to my patients all the time, especially women that are complaining about, pelvic pain and who are having recurrent yeast infections and UTIs. And I look at them and they're wearing these skinny jeans and tight pants. And I tell them that this is not helping your situation right now. Your pelvis is not just an anatomical pelvis. It's where our microbiome partially lives, right? The microbiome is the healthy gut bacteria that lives in the bodies, starting from the mouth to the anus, right? Like, and the rest of the body, but a majority of your microbiome lives in your GI tract. And especially when we're looking at women's health, the microbiome really has a place there, and it can affect our pH levels. And so when there is healthy bacteria growing in that area, the pH is happy and in balance. And when there is now a change in the pH, that means that other bacteria can grow and possibly cause imbalance in the area, meaning more infections, more like bacterial vaginosis, yeast infections, UTIs. And that's where nutrition becomes really important. Like, what you're eating, how you're fueling your body can also fuel your microbiome. Nutrition is a really big part of pelvic health care and women's health care, especially as we age, especially during our monthly cycle. All of this affects, it's such a fragile system, right? When we're looking at our periods, when we're looking at our hormonal health, when we're looking at, how our estrogen levels drop as we get older, as we enter into perimenopause, menopause, postmenopause, right? It not only affects like our moods and, the physiology of the body, but it's also like affecting your muscle mass. As you age, we naturally lose 10% of our muscle mass each decade. And as women age, as the estrogen levels drop, our muscle mass also starts to decrease more. And so when we're looking at muscle mass, we're also looking at bone health, right? And as women age, then one of the number one concerns is osteoporosis and osteopenia, which is weakening of the bones. And so making sure that like your muscle mass is nice and strong for your bone health is essential. And so when we're looking at women's health, when we're looking at pelvic health, nutrition is extremely important, from the microbes that we're introducing into our body through the food and beverages that we're drinking, through the amount of protein that we're eating, through even consideration with different supplements, calcium, iron, adaptogens like ashwagandha, which can help relieve stress. So this whole nutritional aspect related to women's health is essential to living healthy and feeling like you're in balance with your body. One kind of feeds the other, right? Because when your pelvic floor is imbalanced and when you're experiencing pain or the muscles are spasming, where does your mind go? Your mind is automatically going to go to the pain, and your life becomes about the pain, and your stress levels start to increase. And so in situations like that, we want to calm the nervous system down, and calm the nervous system down through stretching and pelvic floor physical therapy exercises, through eating a healthy diet that's allowing the muscles to also calm down by lowering the inflammation in the body by following an anti-inflammatory diet, and also by practicing stress management, by changing the focus away from the thing that's happening in the body to the possibility of healing, and the possibility that there are all these different strategies to help calm the body down, to help calm the brain down. And when you're calm, the symptom also calms down, most likely.
How would somebody know if their body or their pelvic floor was in balance or out of balance? Are there some like key indicators when you're sort of emerging into this space?
I mean, I think from the outset, if someone is experiencing overall tightness, in their hips or in their pelvis, that can be a first sign. If they don't have overall good mobility, maybe if they were a runner before, or, they're, just a general athlete and being able to do a certain movement or exercise and it's become harder for them, or they don't have as much mobility. I think that can at least be one sign for folks to have a good sense. Like if there's already tightness in their hip joint, if there's tightness and lack of mobility in their spine or in their sacrum, then that can, already for me lead me to believe that there's probably also some like pelvic floor muscle tension that's also present as well. I would say also, if anyone is like, if you have, regular bowel and bladder habits that they've always been pretty regular, you're having a bowel movement every day, or, with regards to urination, you don't have to strain or push to go and pee, and you're not getting up in the middle of the night to go urinate. And if that starts to shift or change, where you're dealing with more constipation, if you're having more frequency, you're noticing that like when you cough or you sneeze that you're leaking, and that wasn't the case before, that's definitely a sign that something has shifted or changed. And so it would be worthwhile to be able to do some investigation as to why or what it is that is, creating those changes.
So, what will people be doing in the workshop? What are the kinds of activities and education people can expect to experience?
Yeah, so this is really designed to be a place where you can discover and explore your pelvic health. And it's not just through like anatomy, but it's also through looking at your lifestyle habits, right? Like through nutrition, how you're managing your stress, and how those two things might also be affecting the health of your pelvis. But it's also designed to have you explore movement through, I'm sure physical therapy, exercises, and movement, but also yoga, and also stress management techniques like body scanning, tapping work to help calm the body and the nervous system down, and journaling exercises and group sharing. So part of this is to form community around this topic, and to also just like further your knowledge and your education, to have like 3 days, I think, to just really like explore and ask questions around this
Yeah. And
topic.
so just having that understanding of like your own anatomy. And if you don't have an understanding of your anatomy, it's really hard for you to know where you need to go next or what you need to do in order to be able to tend and care for it. So for me, it like definitely just having that education. So it'll be, a very embodied and experiential type of practice to be able to really explore our pelvic bones, the pelvic floor muscles, all of the organs, to actually like externally actually be able to palpate and feel our bladder and feel our uterus, and also to feel the connection of, whether it's our breathing or our core engagements, and how that also affects our pelvic bowl as well.
Could we talk about epigenetics? I mean, I know like trauma and shame and is specifically stored in our pelvis and our sex chakra, our hips, and we often first discover some of that healing through yoga when we do a hip opener and experience that emotion. Can you speak to the trauma and shame in that part of our bodies?
Yeah, so a lot of what we experience in our body is definitely stored in our genes. And I'm definitely in the belief that even though our DNA is written, when we're born, but that we always have the ability to be able to change it. And so whether a mother is experiencing, especially when it comes to UTIs, for example, or incontinence. And one of the things I always hear is like, oh, my mother had this or my grandmother had this, so it must be hereditary. So I think that, yes, there could be definitely a component to that. I think that, when we're looking at not just the physiology, but also how our mental health, how our nervous system health also plays a role in what we're experiencing physically, that definitely can be embedded and seated, in us. And especially if, our mother or our grandmother was experiencing level of stress or unsafe conditions as they were growing up and carrying us in their womb, that definitely will have an impact on us as well. And so but I do believe that even though that might be written in our DNA, that whether it's nutrition, having a better understanding of how we're managing stress, looking at our lifestyle and our habits, our everyday habits, and again, that education and that awareness of like, okay, my mother, my grandmother, had a lot of shame and they didn't talk to their doctors, or they didn't talk to other women in their family about their pelvic floor health. But I'm wanting to take a stand and actually shift that and change that, trajectory, and actually have more advocacy around that I think that can actually make a big change and a big difference.
And I'm sure like most people understand what epigenetics is, but in case they don't, epigenetics is basically what it translates to is that your environment can change your genes, right? And it can ultimately change your health. And so, when you're looking at like how your environment affects this part of the body, it can have both a positive or a negative influence on the pelvis, right? And what you alluded to in your question was trauma, right? Like it, uh, this is an area where people may have experienced trauma. Whatever trauma was, trauma is still trauma, right? And like when it affects this area of the body, it can make you feel very like paralyzed, right? Especially with sharing yourself with someone in an intimate relationship, or even seeking medical care, or even pleasure in yourself. And so when we're looking at trauma in this part of the body, it's firstly okay to feel very protective if that is what someone is experiencing, and do what you need to do to take care of yourself first. And I think that when you're looking at pelvic health, it's so important to know that this work is interrelated, and you're doing this as a part with a care team, right? And part of your care team is a therapist, hopefully, because there are a lot of emotions, just like you alluded, that are stored in the pelvis, right? And once we can start to explore those emotions, because sometimes when something scary that has happened to you, oftentimes people don't want to go there. Like you don't really want to see that or talk about it. But once you start to kind of go through the trauma and explore it, that's when the healing happens. That's when the emotions that are stored in the area can actually release. And so if someone who's listening to this right now is experiencing trauma in that area, I just want to say, practice self-compassion and honor where you're at. Listen to yourself. And if you need to protect yourself right now, I think that's really smart. But know that it's also really helpful to discover slowly this part of the body with someone you feel safe with, whether that's a therapist or a friend or a medical provider that you trust, or even a pelvic floor physical therapist. And so the work when you're looking at trauma is very complex, and it's taken very slow. Part of what we're going to be talking about on our retreat is not only just discovering this topic of the pelvis, but we're also going to be really talking about the nervous system. And so when someone's experienced trauma, that is where it also impacts the body, it impacts the nervous system. And so when the body is constantly in a fight or flight response, which is a sympathetic nervous system, you feel like you're constantly running away from a lion. And every interaction is hypersensitive and alert, and you're on guard. And living your life that way all the time can feel exhausting. And so, maybe one thing that someone might get out of this retreat is just learning how to take a step back and learning how to step into the parasympathetic nervous system, which is the rest and the digest nervous system, the calming nervous system, and learning how to regulate the body, regulate the breath, regulate feeling okay. Feeling okay is underrated. Feeling okay is really good.
So many of us, so many people I know are going through things like having fibroids and having cysts and having, hysterectomies before 40. Is it from that trauma? Is it genetics? Is it our food systems, our environment? I can imagine many of the seekers who are coming to take your workshop will be bringing up those issues and wanting to make those connections.
I had an MRI done the other day on my back because I have a herniation in a disc, and I'll share my story. And I had attended a meditation retreat 2 weeks ago. I gave myself the gift of a meditation retreat for my birthday. And I went, and like part of the work I was doing there was working with my body. And I was actually telling my body what I wanted it to do, right? I wanted it to heal in certain parts of my body. I wanted to command my body to do certain things. I know command is such a masculine word and it's slightly off-putting, but basically I was, really encouraging my body to heal. And I went for this MRI last week and the results came back, and the herniation that I had a while ago was still there, but some other things improved around it. Also, there was also like some kind of like wear and tear around the spine. And part of that is because I'm a very active person. I live in New York City. I walk everywhere. I teach yoga, I dance, I like walk more than 10,000 steps a day. And so part of that is that if I don't get stronger, my body is going to bear the brunt of that activity, right? And so part of my journey has been getting stronger. What I'm trying to say is that it's so much about your question was, how does trauma come up in the body, especially in terms of the pelvic health and like women's health conditions, is like part of this is, as we age, and if we don't take care of ourselves, meaning mentally or physically, and we are not as strong as we can be, I personally believe that's when things start to happen, right? That's when things start to happen, when you're kind of leaving yourself like open, out there, like, okay, I haven't done the things that I need to do. And these are when things will naturally start to, the opportunity for things to naturally start to happen as we age, the risk is higher. And so part of like dealing with that is also making sure that, okay, what am I doing? What am I doing in terms of like getting stronger? What am I doing in terms of my mindfulness practice or my meditation practice? What kind of thoughts am I feeding myself? What am I looking at on social media? What are the, limiting belief systems that I have in my life? Who is around me, my social connectedness that is positive or draining me or giving me bad messages? Do I like my work? Does it bring me joy? What's my sense of purpose? Do I have healthy outlets, right? Like, how am I moving my body? How am I moving that energy? The reason I dance and practice yoga is because it's a way for me to move energy. I also am a ceramicist. I use my hands a lot, and that's another way for me to move energy. So part of this is how are you taking care of yourself? How are you feeding yourself? Do you have time to even sit and eat mindfully? Or are you eating in front of your phone or eating in front of your computer? I know it sounds like it doesn't really impact. It's just like, it's like whatever, right? But it does make an impact. It makes a huge impact because we are living in very disconnected beings right now. We're not connected to our own bodies, right? The term proprioception, feeling what's happening inside of the body, like knowing how your body moves, knowing what it feels like to feel okay. right? Like so many people don't know what that feels like, especially like Tia said earlier, like if your body has gotten used to compensating for an injury, that's just how the body moves, right? Your body's going to move that way. And like these things like, oh, I just have a tight hip, that becomes normal and that becomes a belief.
In listening to both of you, I'm seeing myself, I'm recognizing, I'm congratulating myself for the good things I'm doing. And then I'm, panicked by the things that I need to clutch up on and do. And it makes me think about, I don't know if it's because I'm in my 40s, but it seems like my algorithm or just the media in general is talking more about protein, talking more about hormones and ways. Is that the case? I mean, is that where some of the workshop is going to be talking about, like anything from more protein intake to peptides, which have become very popular in conversation? All of that stuff just seems to be top of mind. I think the New York Times just did a podcast episode about why is protein, on everyone's mind. What do we do with all of this? Because I think I feel a real sense of urgency to up my game in the gym. But then I'm also like, well, maybe I'm okay or what? I mean, I think it'd be easy to feel overwhelmed.
Yeah, I think it's very easy to feel overwhelmed, and it's the same like what I see on like my algorithm as well, and the headlines in the newspapers. But for me, and I think when I have conversations with my patients as well too, it's really that you're just doing the best that you can, and that I think that whether it's protein, whereas like maybe 5 years ago it was eating more fat, and there's always a trend. And for me, it's like really thinking about, you know, maybe 2 or 3 generations back, like how did my ancestors eat? How did they move? Like what did they do that they, were taking pieces of whether it's nutrition, whether it's being in community, whether it's movement together, whether it was farming or singing or going to church and having some type of spiritual practice, that they're able to take all of those facets and still be able to live a really long and in some cases healthy life. And I think it's very easy for us to hyper focus on do this one thing, and I think that's the case right now, especially in perimenopause and menopause. And it's really about like eating a lot of protein, making sure you're having enough fiber, taking collagen peptides, making sure that you're also weight training, and doing all these things or strength training, and that it can feel very, very overwhelming, and then you can still have an issue, even if you're doing all of these things as well. So I think a lot of it is just like, how can you find balance? I think ensuring that you're finding balance with all the things, knowing that you can be doing all of the right things, but something can still happen, and also being okay with that. And I think also just, take in what's helpful for you, but don't allow that to really rule or dictate, okay, now I'm going to just be buying like packaged protein powders or whatever that is and not enjoying life.
Yeah, this is something I see every day as a dietitian. And the one thing I remind my patients about is that, we never want to like approach nutrition or food from a disordered mentality where we are hyperfixating or obsessing over food. Or we don't want to look at exercise that way either, because there's this term called orthorexia, which translates to exercise addiction. And so it's really important to get your information from reputable sources. And I know the New York Times is a reputable source. I'm not saying that. I'm also, what I'm trying to say is that I think that before we start making changes to anything in our diet, we have to ask ourselves, why are we doing it in the first place? And where am I mentally right now? Where am I moving from? Am I moving from a place of stress and anxiety, or like, oh my gosh, I have to catch up, I have to do this now? Because most likely, if you're approaching making lifestyle changes from that area, it's likely not going to stick, right? And I think that so much about like healthy eating is enjoying the food that you're eating, right? And having diversity in the food that you're eating. A lot of the people I speak with, they have the same foods every day. There's like a routine with the way that they're eating. And while there's nothing wrong with that, if there is a change that someone wants to make, that might be the first place that they look at, right? Like if I'm eating the same thing every day and it's not giving me the results that I'm looking for, then what else might change? What are my goals? What are my health goals? What's important to me, right? If like just following this diet like 100% of the time is that's what I want to do, then the next question, will that make you feel happy? Is that going to bring you joy?
No, I totally agree. And I feel like, yes, the joy and the pleasure is also such an important factor. And I think like, even if someone is like, okay, I'm going to, consume more protein or collagen peptide or whatever the fad is I think is also checking in is like, well, how do you feel afterwards? Like if you feel super crappy after consuming all of this protein because that's what you're told that you need to do, or you need to strength train and do more of it. I mean, but are you feeling satisfied? Like, is there a level of, satisfaction after doing that exercise or consuming whatever that is? If you're just doing it and forcing yourself to do the thing because that's what this influencer said you should do, then how can you see that as beneficial and also that it's going to be something you're going to do long term?
Yeah, I
So,
see this all the time as a yoga teacher, where like people are always wanting to do the harder pose, they're like, oh no, it makes me a better person because I can hold the plank for longer. I'm like, does it though?
yeah. Yeah.
Does it make you a better person? Or like maybe sitting in like sukhasana or an easy seated pose and just like being quiet and breathing, maybe that's more powerful for you, right? And this is why I love the practice of Ayurveda as well, which is the sister science of yoga. It translates to the science of life. Is that she says that like every person is an individual, and it considers our relationship with the environment and the seasons, right? And so like one diet might be good for you, but it might not be good for someone else. One way of being physically active might be good for you, but it might not be good for someone else. And I think that's really true in our Western life as well, right? Like just because something came out saying that this is good for you, or your best friend's like following a 1,500 calorie diet and is having like tons of protein and supplements, doesn't mean it's going to be good for you, right? And so I think that my goal as a dietitian and as a healthcare worker and a wellness practitioner is to like help people realize like, okay, yeah, that's all happening. That's going to be happening long after, this is just the science of science, right? And research. Things change all the time. And that's great. And I'm really grateful for it. But we also have to be very practical and also know our bodies really well. And that's where that's the baseline. And we haven't reached baseline yet.
I had a patient come in earlier this week and I hadn't seen her for probably about 2 months. Yeah, 2 or 3 months. She had just had her third child, was diagnosed with like prolapse, was really scared of having this third child and having a worsening of a prolapse. And so I worked with her, during her pregnancy, worked with her in postpartum, and, took a break for about 2 or 3 months and then saw her this week. And she said, she, was also experiencing pain with intercourse. So she had intercourse, it was painful. And then realizing, okay, well, I haven't been very consistent with, the exercises and things that I gave her. So she was actually very diligent. She worked on everything for a whole month, consistently. And then a month later was able to have intercourse with her husband, her partner, and didn't experience any pain. And was like, and a lot of those, the testament of like, is the consistency. Because I can give like any exercise, which can be really helpful. But if you're not consistent and able to dedicate the time and the energy and realize that it's a self-care practice. It's not something that you're just going to do for the short term period, maybe for the short term. And then it's something that you want to kind of continue to revisit and have, part of your lifestyle in some way. And I think that consistency is something that's missing, in a lot of our culture, whether it's like how we're eating or how we're exercising, taking care of ourselves, and that when we can actually dedicate that time to really care for our wounds and care for our pelvic bowl, that we can actually, really see those changes. And so that's definitely one of the things that a lot of patients have noted. It's the same thing with like scar tissue. So like I love working on scars. I see a lot of scars. So whether it's, from C-sections, abdominal surgeries, low back surgeries. And it's the same thing. Like the scars will definitely have a huge impact and influence on how we move and how our organs and our tissues function. But scar tissue stays with us, forever until we leave this earth. And so it has to be something that you are really diligent about talking to, touching, accessing, on a regular basis. And so I'd say like the biggest thing that where patients have actually seen, a lot of benefit, and it's never like 100%, so even the patient I mentioned with the pain with intercourse, so like, yes, it's better, but then certain positions like, okay, she's still dealing with, so, there's always still more to uncover. But like for her, I think that was a really big thing, was like, okay, like I'm going to dedicate, this is something that I want to improve, because it's going to improve my quality of life or improve my connection with my partner. So really just finding that time and dedicating and being consistent, with that particular, work that we did in order to be able to see the changes.
Yeah, I mean, for me, I would say that the biggest compliment that I can ever get from a patient is that they've improved their relationship with food and exercise, where they're not experiencing stress or anxiety around food and eating. They've made peace with food. They've also developed a better relationship with themselves and their bodies, and they are, learning where their behaviors come from instead of just masking and continuing to try different things. They're doing the hard work of like uncovering, why am I this way? Why are my behaviors this way? And I think that that's always a really great place where I know that whatever this person is going to experience moving forward, whatever therapy that they're going to get, there's already a lot more calm in their body because they're experiencing more peace instead of anxiety. This natural act that we do multiple times during the day, which is our connection with food, right? And that should be something that is a gift for most of us, right? Like it's a gift and it's a privilege to have food on our tables and to eat. And yet, in the society that we live in today, there can be a lot of stress around it. And so, in many different ways. And so, uncovering their food messages that they receive from their family, also their messages around body and beauty and what it means to be beautiful. And also, it's always a compliment when I hear someone, tell me that they feel heard and that I have been sensitive to their concerns and also culturally sensitive, because this is all a part of it, right? When you're looking at a lot of like ancient wisdom, you look at the area of the pelvis, which is the second chakra, which is Swadhisthana in Sanskrit, the sacral region. And that area holds a lot of potential, a lot of fertility, a lot of creativity. And so when we uncover our energy, when we are able to live from a place that's not filled with anxiety and stress all the time, we have more opportunity to really listen to our body, right? And to heal and to unblock blocked areas. And so when we work on ourselves, right, in a way that's compassionate and kind, it's rewarding, right? Because the body starts to heal.
So if you want more information just about me, so I am on Instagram and it's Self-Care Physio. And I have a website also called selfcarephysio.com. And I'm also on Substack. And that's Tending to Your Womb for Substack. I have a book coming out next year in April. And so the title of that is Tending to Your Womb, and speaking to a lot of what we discussed, but really about caring for the womb, throughout the whole entire reproductive spectrum. Yeah, and you can find me there. And then hopefully if you're able to make it out to Esalen in October, it would be really great to also meet you in person.
Yeah, and if you're looking to connect with me, you can find me on Instagram at Om and Spice, OM and Spice. My website is omandspice.com. And you can also connect with me on my Instagram page, which is also Pottery by Krishna. I forgot what. And yes, I'm looking forward to connecting with you more at Esalen if you're joining. But even if you're not joining, it'd be lovely to connect a little bit more around this topic.
Thank you both. It's such an important topic, and I just feel like we're going to be inundated in great ways with more and more and have the tools to take care of ourselves. Thank you.
Thank you for listening to Voices of Esalen. This episode was produced in conjunction with Shira Levine. Our theme song is by Nico Holloman. Until next time, be well.